it be the most successful and safe derby on record for both humans and for thoroughbreds. And may all be winners. And most importantly, probably after life, may it have a record positive economic impact on our entire community. And even probably the most important, may your own Derby Fest health outcomes be manageable. I'm certain, as I said in the beginning, probably off the record, I'm certain some of us remember at least one high school infield experience. That was a never again for me. But anyway, that said, the May meeting of the Louisville Metro Board of Health is called to order in early recognition and deep respect for the upcoming National Nurses Week, which begins next Monday. Hug a nurse, and the indefatigable commitment they make in this community every single day. That said, the May meeting of the Louisville Metro Board of Health is indeed called to order and being streamed live on Facebook. A few items before the chair introduces our speaker. We again welcome Dr. Katie Cardarelli, who will join us a little later, the new dean of the School of Public Health and Information Services. Our June 5th meeting will feature Dr. Ted Smith, U of L School of Medicine Associate Professor and nationally recognized leader of the Christina Lee Brown Environment Institute, who will share perspectives on food as medicine. As you know, the July meeting will be a short business meeting, action items only, with the election of a new chair and vice chair. There will be no August board meeting per our tradition, and we'll start anew in September and run by the very apt Dr. Bautista Cervera. And she will provide the information, notice, and et cetera, for that. Finally, the April board meeting minutes were circulated in your pre-reading materials. The chair will entertain any comments or edits, followed by a motion to approve. Board?
This is Dr. Scheid, a motion to approve.
Thank you. Is there a second? All in favor, aye?
Aye.
Aye.
Opposed?
Aye.
Abstentions? Motion carries. It is a distinct privilege to introduce today's prospective session speaker, Elder Angela Overton. She is the founder and CEO for the Carewell Center in Louisville, serving multiple individuals with serious illnesses in communities such as Smoketown through her work with the faith-based community. She is the senior advisor to the Washington, D.C.-based Coalition to Transform Advanced Care, CTAC, where she leads the fight for policies that improve the lives of people impacted by serious illnesses in areas such as greater access, equity, and enhanced quality of life. She earned her BA degree in history, focused on social sciences, and a Master's of Divinity degree, as well as a Black Church Studies certificate from the Louisville Seminary. She received her ordination as elder at Mount Zion Fellowship in Cleveland, Ohio, and as a reverend at Greencastle Baptist Church here in Louisville. She currently sits on a number of boards, including Grant Makers and Aging Task Force on Equity and Aging Philanthropy, and the Wert Scholar School of Social Work at Yeshiva University. Elder Overton, the chair, yields the floor to you for your presentation, followed by a short Q&A recognizing your boarding commitment.
Thank you so much, Heidi,
Floor
for
is
that.
yours.
I appreciate the introduction and just sharing the experience. It is a privilege to be before you all here today. I just want to say is just give an open overview of the work that we're doing here, particularly in Louisville. CTAC, the Coalition to Transform Advanced Care, is an organization in Washington, D.C. That works on improving the lives of those that are experiencing serious illness. We have a few lanes. We have policy and legislation, we have workforce, and we have community engagement. The community engagement piece is the one that I work on intricately. I am committed to the work of this immensely. Uh, in our country, we're dealing with community members who do not receive quality care, completely underserved. And in my 30 plus, almost 30 years experience providing pastoral care throughout the country, as well as in places of worship, I have seen a number of individuals tragically succumb in an inhumane manner simply because they did not have qualitative care. So the project that we are working on in Louisville, and I want to give you an overview. It's been a 4-year project. We are focusing on a severely impoverished community of 40203 in the entire area of West End. We partner with faith leaders to make a difference. These are individuals who are trusted by community. And what we do is we provide them with the supports that they need to serve at risk and as well as those who are underserved. In 2020, we started working at the midst of COVID, and we provided what the faith leaders said were impediments to qualitative life. And so you all know that social determinants is a huge issue for impoverished communities. So we partnered with many organizations to provide a wraparound care. We started this Louisville Community Care Project. We're in partnership with AARP, Assessia Health. We have Humana, Norton Healthcare Foundation, Baptist Health. We're in partnership with the University of Louisville, the Traeger Institute, all of these entities to provide the supports we need. There's two pieces that we're doing. One, we're journeying with individuals who are having difficulties navigating this care. And we are connecting them. The idea is to connect them to a community health worker. Once we've connected them to that community health worker, there is an initial assessment. That community health worker is held at U of L Traeger Institute. And when that individual does a Flourish Index, we use that as an assessment to quantify or to qualify what their current needs are, as well as not just healthcare, but socially. Are you dealing with social isolation? Are you dealing with healthcare, health issues, food issues, transportation issues? And then the idea is to utilize our partners. One of our partners is KIBDA. And so if they need Medicare, if they need Medicaid, we don't connect you to a link. We as individuals provide you with the whatever it is you need in order to get onto Medicare. There is a lot of underutilization of the resources that we offer, many good intended organizations, but because the trust has not been built, relationship, rapport, all of these pieces have not come to pass because, to be quite honest, this community and the members have been traumatized. I have been looking intently in Kentucky, and what I have found with Kentucky is that this is quite different than any other states that I've been working with. You have chronic poverty and you have persistent poverty. And you have this notion of persistent poverty. It's based upon regions. And so Kentucky is one of the highest regions or counties in the country where you have areas dealing with poverty. So it's not just my granddaddy was poor, my daddy was poor, and I am poor. It's more than chronic poverty, it's areas. So you have systemically issues in this community that has continued to traumatize a community generation. Now we know there's racist and systemic issues that we're dealing with as well. So the individuals and the organization that says, hey, we're here to help, the response is, are you really? So by working with faith leaders who are trusted, who are already on the ground in the community doing the work, we have an opportunity to build relationship and rapport that is meaningful. So we do a wraparound service. The other piece is that we have events. We have Caregivers Gala, we have Community Fest, we have advanced care planning events. We do it in a way where the community can receive the information while at the same time providing respite. So I'm going to stop right there for questions. Again, I apologize to you all. I am in an airplane getting ready to board, or well, I'm already boarded and going to a conference. So I apologize for the backdrop noise, but that is a basic overview of what we do. I want to tell you, John, the CEO of CTEC, I was on a call with him yesterday, and he was like, Angela, tell me, and just provide me with a story as to the reason why we do this work. So I'm going to share that same story. Uh, there's a faith leader, Dr. Angela Johnson. That's one of our project leads. She's over at Grace Hope Presbyterian. And she has a member, or had a member that was declining. And she wanted to stay in her home. The reason why she wanted to stay in her home is because she wanted to be close to her family. Now, mind you, this is a family that has lacks transportation to get to and fro. They wanted to put her in a nursing home that was extremely far away from her family. She knew that her family would not have access to her, nor could she begin to share with her what she wanted to share at the end of life. So she decided to stay home in this neighborhood where her home was not wheelchair accessible. So in January, there was a fire at her home and she could not get out and she died. And this is the reason why we do these wraparound services, because no one advocated for her. And we know that we're building a business case. So we know that having a value-based system is cost effective because you have a consumer that is satisfied. And at the same time, you have the services that are being provided at their, at, if it's at home or in-home care, you have these services, but then you also have, you're saving, it would have been more expensive if we had allowed her to go to the nursing home versus giving her the care that she needed and some adjustments to her house, which she could not afford. The fire department could not get to her, and she was fully aware that she was dying. That's inhumane. And we hear these stories all the time. And so I'm going to stop right there for questions.
Thank you. One very quick to start off, and then I'll turn it to the board. And you can send me this. You don't have to necessarily talk about it, but if you will send me any policies, public policies that Metro Council or the state legislature here could adopt that would ameliorate in some way the pain that you've just shared with us, that would be superb. I'm sorry.
I will definitely do that. We also have state coalitions that's a part of CTAC that pushes the idea of this. So I will definitely send you those information, those documents.
Okay, and we
Heidi,
will
if
share
you
that
will
with
send
the
me,
board.
I will. And Heidi, if you will send me an email to remind me of that, so when I do land back, I will remember to do that.
Yes, ma'am.
Mm-hmm.
Angela, thank you. Angela, thank you for what you do. One quick question I had was, I understand that you're providing sort of services in the community. What about folks that are leaving inpatient hospitalization that are high risk and that need services? Are you connecting with case managers in the local hospitals?
Well, you know, we are working with Baptist Health as well as Norton Healthcare, as well as Centerwell, as well as Molo Village that does a lot with Park Duval. So the idea is that, yes, we are doing that, but not with the social workers, but with the individuals itself who are the community liaisons. That's what we've been working with. We're open to working with uh, uh, Norton Healthcare as we are, but the issues have been um, uh, HIPAA laws and confidentiality. So we do not get a preview to all of the situations. So I want to say that we would like for that to be an option, but right now, no.
What would be helpful is probably that you all are on the discharge planning list that those people get. So I will also talk to Russ Fox's folks at Norton for that, and we'll work on that.
No, I think part of being in all three hospitals would be helpful because you might be able to identify patients that need that wraparound services from case management standpoint that you're talking about for sure.
Also, one of the pieces that we're doing is our focusing on individuals who are not in network. We're focusing on individuals who are not in the system. We're focusing on individuals as to you could be in the system. So that's really our focus in really, I think, relieving the burdens of the ED system that we're really focusing on. We're finding with Norton Healthcare and with Baptist Health, for example, as well as Centerwell, that once they are in the system, and once they are aware that they're having difficulty with coordinated care, one of the pieces about CTAC that we're focusing on is those with serious illness and all of these specializations, specialty physicians that she'll need when entering into end of life. So what we're finding is that they're having difficulties with that coordinated care. That CHW will be help them having difficulty navigating coordinated care, is that we will advocate for them and then be in touch with the individuals at Baptist Health or Norton Health to kind of mitigate if there's a problem. But if there is individuals that are already in network and have not reached out to us, that really has not been our lane.
Elder, I will, and Dean Compton, through U of L Health, because they have the tertiary services and acute care and serve a very large under-resourced demographic. So I will look into that and see who the right person is. And then at the university itself, I will make some contacts because I'm on the U of L Health Operating Board. So,
well, that's great. That's great,
yeah,
Heidi.
I will see what I can do. And Dean Compton, any help you can assist with would be greatly appreciated. Whitney Nash, who is the new head of the School of Nursing, is phenomenal, and a U of L grad herself. So there's lots of potential. Dr. Shaw, did you have a final comment? I want to move to other board members before she has to leave.
Absolutely. One last thing I was going to say was another place where this might be helpful also is Palliatus, which provides palliative and hospice care services, hospice, as well as Bluegrass, because those are two sort of organizations that have the CON for end-of-life care in the state of Kentucky, and they cover majority of the state.
Mm-hmm. It's so interesting. I forgot to fail to mention Hospice Health is also a partner of ours, and they're a critical piece, exactly what you're saying. We're doing a conference in September at Molo Village on what's the difference between palliative care, hospice care, and advocating for self. So you are spot on. And I also failed to mention that University of Louisville, their health equity hub, is responsible for collecting data and, as alongside of this piece. So we're going to learn. We're going to learn. We think that this is the way. We're confident, but at the same time, if it isn't, we're going to learn that we need to pivot. And what I think that our good intended individuals and CBOs and organizations, we don't pivot enough. We don't listen enough. We don't respond. It's when we have great, you all are doing wonderful things and amazing things. I think we all have to learn though how to pivot, how to listen and respond accordingly. So that's one of the pieces of this Louisville Community Care Project. And we are just working diligently on just providing the care that I feel as community leaders and workers, we're responsible to. We have to tend to the needs of those we have been entrusted to serve. And I have been in this lane for many years, and the individuals that I have seen to succumb in an inhumane manner, I just don't want to see it anymore. And so we're going to change things around and turn things around. So I do look forward to any contributions, any say, hey, Angela, I heard you, and I'm willing to do such and such. We're interested in tangible a solution so that our expected outcomes change for this community.
I will send you, Arlena, who is our, executive administrator. If you like, you can just send your materials to me. That's fine, and I'll get them to her. But the most important piece is the information, the announcements of sessions, as you just enumerated, that can come to us as well. And we have a best practice communications person who the city is very lucky to have. And so Kathy Turner can get it out in her social media network and other places. So know that there, and I'll text you an email and phone number contact so that you have that.
Okay, excellent. I appreciate that.
Okay, anything else for the Reverend Dr. Bautista Severa?
Yes, thank you very much for sharing everything that you're doing for underserved communities. And I would add, I work for another organization that also does work for underserved communities. So I would like to get in touch with you to see what else can be done for those that don't speak English as a first language. And we have Somalis, Kenyan, Rwandan, Spanish speakers, and many of them may find, themselves in situations similar to what the communities you are working with are going through.
Well, I would love that. Please do reach out to me, because I've been speaking also with the governor's office. And last time I spoke with Governor Bashir, we really believe that this model of care, right now we're focused on 40203 to learn. We believe that it has national implications, but the model is for any area or any individuals with similar demographics. So we're looking to, right now, 40203 is heavily populated African Americans, but we have not tapped into building relationships with our Hispanic brothers and sisters, as well as indigenous individuals in Kentucky and rural Kentucky, as well as white poor individuals. And so we want this to be an expansive way of being and doing. So I would love to talk with you offline, because we found that getting connected with the trusted leaders, again, so we've gone the arrow the way of faith leaders. So we want to speak to the imam, we want to speak to whomever that has a leg in with people. So I'd want to speak with you definitely.
We will make that happen. Any
Thank
final
you.
comments? We do not want to make the Reverend late or intrude in their life any more than we have, but we're glad we're a part of your life.
I'm glad you are too, and I'm looking forward to the future.
Okay, thank you. Any
All
final
right.
words?
I just
for
think that,
for her?
yes, please, I'm open. Hopefully this was helpful. That's
Okay. Please be
Our-
safe, take good
Will do.
care, and we'll be in touch. Bye. Okay, board. One sort of out of order item I want to make sure that we get. The July meeting is July 3rd. And I know that people generally take a couple days for the 4th of July weekend. If you will, how many people prefer July 10th rather than July 3rd? Or would you like it on July 3rd? You all tell me. Board members, please. Otherwise, I'm just going to go around the room. All right.
Happy to,
Ms. Handmaker, which day?
I will no longer be on the board.
Okay.
I roll off,
Ms.
in
Ms.
June.
Haskell?
I roll off in June.
All right. Well, we'll have a grand send off.
It doesn't matter to me.
All right.
flexible.
Dr. Shaw?
July 10th.
Let's see, Dr. Bautista Serrera.
So we have Dr. Shaw and Dr. Compton for July 10th. So I'll add my vote to July
Okay.
10th.
All right. Dr. Compton, who am I missing? Dr. Miller.
July 10th would be great.
All right. I think we've got a little quorum going here. Thank you. And I would appreciate it, Dr. Miller, if you turned your video on, because that way, that's a rule, and that would be great. I appreciate it. Dr. Grisanti.
July 10th.
All right. Does anybody have any other comments? If not, if there's no problem with that, we'll go with July 10. And Arlena, if you'll note that, I wish you a safe, holiday weekend, and we will hold elections then on that date. Unless Ms. Natalie Johnson, we could do it at the June meeting. It doesn't matter to me, and then we don't have to worry. But I think it's in our bylaws.
What are you trying? What was it?
The issue is elections. Should we do that at the June meeting or wait till the 10th of July for those elections? So
I
that
think-
the new person can start in July. I'm not too anxious to pass the baton. After, I think it's been 6 years, so, and Margulis doesn't believe in dynasties. There's only so much you should have to tolerate of me.
I can check. I think you could do it in June. I don't recall seeing anything in the bylaws, but I'm going to double check right now.
Okay. Well, just let me know, text me or something and let me know. And because I am thrilled, and Dr. Bautista Severa and I have worked very hard over the last year and a half, etc., to prepare her for this opportunity. And I can't actually think of a better person to reflect the face of the people we serve. And I'm thrilled and quite able. And I also want to incredibly thank the team at the health department, now led by interim director Mendel, for outstanding service to this board, as well as to me personally, and that interim director Mendel will be assisting Dr. Bautista Serrera with anything that she needs in the same way that she has ably assisted me and told me where the oopses were and are. So appreciate that. Okay, so let's see where we are. So I turn to Deputy Mayor George for mayoral update. She and I and Councilman Ben Reno Weber have been talking about the ATVs. I had a nice visit with the police department in Cherokee Park, and she oversees a lot of the parks activities. And so, Deputy Mayor, I yield to you.
Good morning. And as you say that, Chair, I think perhaps a future meeting, a future discussion could really focus on health in our parks, because there is a lot of great work being done in parks right now focused on safety and health. And we actually working very closely with Bloomberg Harvard on a project along with our park partners to advance health and safety. So perhaps conversation for another time. I do not have any additional updates from the mayor's office and would defer to public health colleagues for their update. Thank you.
Great. Thank you so much. And glad to see, public health activities in the budget. And so a hat off to the mayor for that. Connie Mendel.
Connie is not here, but I will be happy to provide some updates.
Thank you, Dr. Single. The floor is yours.
Thank you. Few things, few updates. So a couple of weeks ago, Mayor presented the opioid settlement advisory board recommendation to 21 community partners. We went to Choosewell communities, and it's just great to see all the good work being done. And we heard from some of the recipients of those services from Choosewell community and saw how one person at a time, because I truly believe in one fish at a time, on the ocean side, and all the jellyfishes on the beach washed off, and then you pick one at a time, saving one life at a time. And it was truly wonderful to see how Choosewell communities and other partners are making a difference. So we're working on that. And then other important thing, as you all know, that we have launched a health equity dashboard that was announced a few weeks ago. We are now in the next phase of that, which means Kathy Turner and her team is bringing awareness to community partners. We strongly encourage all of you to reach out to people that you know and make sure they all respond to surveys that are coming their way, which is for community health improvement planning. So we can do a child chip assessment and then figure out how do we come up with actionable items and make a difference. As Ms. Overton mentioned, and I have met Ms. Overton in the past, we all know there are inequities. We all know there's so much that we can do, but sometimes things just don't go through the proper channels and things don't get done. And so we're going to make sure that we work on that. And then we are offering free radon test kits. And if anyone is interested, they can go to Louisville Metro Health website, and there is a page for radon, and they can retrieve those kits if they need it. The other thing that I was going to talk specifically about this time, but I'm not going to do that because I'm going to leave Dr. Carrico to present what we've been talking about immunization in JCPS.
Very good. And I hear you've done excellent work with JCPS and brought them along immeasurably, and the board and I'm sure the city are greatly appreciative for your very special skills. Thank you. Let's do, and Dr. Lockett, I think I see you on. Do you have anything to add? You're muted.
I don't think I have anything to add at this point. I just think, to echo your sentiments to what Dr. Single has been able to do with JCPS and immunizations, and we continue to look for ways to grow and, promote our services in new and innovative ways to really reach the community, especially those individuals who maybe have not previously had as much access to the services.
Excellent. Excellent. I appreciate that. Arlena, let me look for you on the screen. There you are.
Yes, ma'am.
I want to remind the board members with the required documents and training. And Marius is known for calling names. I won't do that today, but beware. It's a coming. You want to just give us the detail here?
It's just for financial disclosures that were needed to be notarized and turned in. If you need notary assistance, I am a notary and I can assist you with that. Also to make sure that you are sending information about your Board of Health or Metro Board's email address. And that was it.
Thank you so much.
You're welcome.
That's all. Dr. Ruth Carrico, the floor is yours as immunization lead in immunization person, committee chair, who will share the new charge for the immunization committee. And we will put a copy of that charge in the post-meeting notes. And so she'll get that to you, Arlene, if you don't already have it.
Thank you very much. It's a delight to be here. And really, after listening to Elder Overton and Dr. Single talk about immunization and with what Dr. Lockus is doing in helping lead this at our local level, it is a delight then to have this opportunity where we can stop, take a look at the work that occurred under Dr. Bautista Severa in helping to pull together partners as part of the pandemic response. And now that we are at a very different place, thank goodness, with the pandemic, our committee then thought that it was a good time for us to stop, take a look at the charge, and be able to determine how we need to give new life to the activities so that we can then remain within the elements of that charge. Which includes community engagement, providing then what our partners within the community need in order to address immunization efforts. So not only do we have to consider COVID-19, but we also then have had the opportunity to look and see where our gaps are, where our opportunities are, and broader immunization. And I think Dr. Overton, our Elder Overton, really focused on what is happening in our older and our particularly vulnerable population. And it's a good time to remind that more than 25% of our hospitalization and deaths with COVID-19 have involved those that are actually in long-term care facilities. So our need to look at this with a wider lens is necessary, and I think this is a great chance. So what we are doing in this committee with Dr. Anna Wong Schrader and I then are looking at how we can take inventory of what services are provided, and we thought that the best place to start this new journey is to take stock of what is actually happening in our community. So in the document that Alana will share with you includes not only the charge, but what we would like to have as our new approach. We would like to start with a taking inventory of what is happening in our community and almost developing what would be a state of immunization in Louisville and Jefferson County. Who is providing vaccines, under what circumstances, where our gaps are, where our community partners are already undergoing some activities or where they have an interest, so that we can say, here is where we are, and then be able to develop then a strategic plan, a map for what we need to do within our community and really take advantage of what has been learned in the strong work with JCPS, looking at what groups such as the Kentucky Nurses Association has done and being out into areas where we have not only high need, but we have then a noticeable lack of support types of services. So we want to avoid duplication. We want to take advantage of community interest. So we'll start the journey then at the very beginning. So we will be reaching out to a number of partners. It was great that our chair mentioned the School of Public Health here at the University of Louisville. They have had a tremendous impact in the community and understanding the data, where data lacks. So we will certainly be reaching out to the school to help us as well in gathering some of these data and helping us then provide what we hope will be a useful document. After we have that document, then we want to develop some actionable steps. What what do our community partners need? What do they want? What resources do we have available? And then I think focusing on where we have noticeable gaps, not only here, but across the country and beyond, in that we lack the ability to provide our providers with concise information about vaccines that are available, basic information such as clinical indications, what are particulars about handling and management of that vaccine, so that we have then resources to provide individuals within their practice settings so that vaccines can be provided accurately and safely. And then we take advantage of disease prevention. So I see Dr. Cardarelli. I have not had the opportunity to meet you, but I've a long standing work with Dr. Paul McKinney and others at the School of Public Health. So I'm excited to, and I'll be knocking at your door and inflicting myself upon you, as Heidi has said. I'm going to use some of your words, Heidi.
That's okay. There's a licensure fee, but hey,
and then take advantage, of what we have in our community. I have a long-standing work in infectious diseases, as I'm at the twilight of my career. It's not dark yet, but the stars are out. But what I view this as the opportunity to do the things that are particularly important to me as a lifelong member of the Louisville, Jefferson County community, and be able to take the skills that I have acquired from being part of this community, and then make sure that this community has a return on that investment. So I'm
Thank you so
happy to have
much.
this opportunity. Thank you. And I don't
so
think we have a
much,
vote or anything. It's all informational.
That's okay. That's okay. Thanks. Huge recognition for the work at Broadband Arena. We could not have been as successful or on the front page of the New York Times without the fine hand of the greatest nurse on record. So, and a doctor nurse at that. So thank you so much. And I saw that Dean Cardarelli, whom we are incredibly fortunate to have. I love stealing things from the University of Kentucky because we are the University of Kentucky here. And a great reception. And Dean Cardarelli, I know you're on mute. Do you wish to say a few words?
Sure. Thank you, Chair. And Dr. Carrico, I've heard terrific things about you since I've been here. I'm in week 4 of my new role, and I'm sorry I don't have video today, and but I'm bouncing in between meetings. But certainly immunization is an area of personal interest. I have an NIH grant focused on vaccination and believe strongly, obviously, as Dean of Public Health and Immunization. So whatever collaboration opportunities there might be out there around this space, we would be very interested. So perhaps at some point we can find a time for us to get together and explore that. Thank you, Heidi.
No problem. And we will have you present at a future meeting. She will be an active member of this board and an engaged member of this board. And as I mentioned, as an alum, a point of personal privilege, it is such an honor to have you at the university, and know that you will take the School of Public Health to national recognition. That's my greatest desire for you, and know that you, with the team, will get that done.
Thank you.
Moving right along, is there any old business, any action items there? This is not the end of the meeting, though, so don't hang up. Okay. Very briefly, a minute or so, 2 minutes or so, Dr. Irwin and Ms. Shoemaker, the Medicaid, any Medicaid issues, and any federal family health center issues, or any Medicaid coverage issues. And to say any Medicaid issues is today's greatest understatement.
Yeah, I have a couple of announcements, and then I'll let Ashley talk about Medicaid. Wanted to say that Family Health Centers was one of the recipients of the opioid settlement grant that Dr. Singler was talking about. So that will help us expand our existing substance use disorder treatment program. Secondly, we're looking at our data from 2023 for Family Health Centers. And one thing I wanted to share with you, that last year, 39% of the patients we served, individuals, were limited English proficiency patients. That's the highest percent ever. That's about over 15,000 patients now. And we spent about $1.2 million on interpretive services to serve those patients. So, any questions? If not,
I do. Now, Dr. Bautista Zerera, do you work with then FHC? I mean, is there good communication there?
We do have a wonderful relationship with Family Health Centers, at least La Casita Center does. We share, we have a common certified community health worker that goes back and forth between both organizations. And I know that Family Health Centers has also other community health workers that go back and forth with other different ethnic and local community-based organizations. So they are doing a really wonderful job, and it is Family Health Centers. It is our first to go primary care provider.
Thank you. And the two of you together, I don't know exactly who, do we work with, do you all, the Royal we, work with the Kentucky Center for Refugees?
oh yes, we work with both. Well, now there are 3 agencies who are assisting refugees in the city, providing services, and we work with all 3 organizations.
Okay.
And we do also work with the Kentucky Office for Refugees, so we have a network.
And we're
going.
sure that the services that we offer, this is one of the chair's goals, which is they're not duplicative services, but they're collaborative, and it expands coverage and casework and outreach possibilities that way, correct?
Right. Yep. And in fact, La Casita and Family Health Centers were recipients of the Art of Collaboration Award given by the Center for Nonprofit Excellence last year. So I think it gives you kind of an idea of how closely we do work together.
Excellent. And I'll scooch over on my screen, technical word there, to Ms. Shoemaker. In terms of the coalition, the large number of Medicaid people who lost coverage during, as everything sort of went off of COVID monies. So an update on that?
Right, yes. So, yes, we have seen a large number of people who have lost Medicaid coverage during the Medicaid unwinding, where everyone is having to recertify their Medicaid benefits. However, just recently, the state reinstated coverage for over 29,000 Kentuckians who had been terminated in error. So just to give you an idea of that, it's about 17% of the people who had been disenrolled have now been re-enrolled back into coverage. And some of them have had their coverage backdated all the way to May of 2023. So that is great news that the state recognized that there was a mistake in the way that they were processing these recertifications, and they have corrected that and reinstated coverage. I would estimate that in Jefferson County, it was over 4,500 members who had their coverage reinstated. So we are now in the final months of the unwinding. All of the adult Medicaid recertifications have been initiated. And so those will continue through the end of May. And then we have child recertifications still on the horizon. So for this year, there is a continuous coverage requirement that CMS mandated for children. So no children are being disenrolled at this time. but they will need to begin those recertifications soon. The state has not finalized that date when those will begin. But there are about 600,000 children in Kentucky who will need to complete recertification in the future. So it is still ongoing. We do still have some work cut out for us.
Dr. Shaw?
I had a quick question. Do we have a sense of the impact on the fall of coverage or lack of coverage on the actual outcomes of these patients, Ashley? Or is that something that Medicaid's?
Yeah, we don't have any Kentucky specific data. DMS is sending out surveys to all Medicaid members, including all people who have fallen off of Medicaid, soliciting feedback. But I can say Kaiser Family Foundation recently did a survey where they found that nationwide of people who had lost coverage, about a quarter of them are still uninsured. So I think about half of them were able to re-enroll in Medicaid. A quarter of them found other coverage through Medicare, employer-sponsored insurance, or a marketplace plan. But there were a quarter that remain uninsured. So unfortunately, what we're seeing is a lot of people are falling off, not because they're not eligible, but because they're not responding to those recertification notices.
So what I would share with everyone, the state have got to figure out how to say this eloquently. The state's data is unsatisfactory, horrendous, non-existent. That's about as complimentary as I can be. That's a wonderful idea, Dr. Shaw. But anything that the state specializes in. And the data that we have, and this was especially true during COVID, was greatly acknowledged there. And I think that, and I'll go back to I don't want to speak on the part of the city, but Deloitte is doing work for in this whole area of Medicaid, so that we are certain we're maximizing the revenue that we get in the right places. So there are workarounds, if that makes sense to you. Yes. But wonderful thought, and that's what it is. And I hope it is as well, and hope it's not a strategy. That with Dean Cardarelli at the Public Health School, that and the focus on data at the university, which is much accelerated because that's one of President Schatzel's priorities. That's in her expertise. That we will make some advances in that area. All right. Let's see. Does anyone else have any updates they wish to share? All right. Well, in adjourning this meeting, accolades and a big hat to the Public Health Department leadership team and all the city employees for their timeless, equity-based efforts to improve access to healthcare in all its dimensions across this entire community. Unless there is objection, this meeting stands adjourned this Derby week under a mantra of stay and be well. Final comments, anyone?
Move to adjourn.
Any objection?
Second.
Meeting stands adjourned. Thank you guys very much. I'm incredibly excited about the turnover of the gavel soon and becoming one of you. Take good care, folks.
Good day. Bye-bye.